Dear Chairman, dear colleagues, it is my pleasure to present my PhD project. My name is Máté, Éliás, and I'm a fourth-year resident fellow. My vision is that in the future, for a woman, having a child over the age of 40 will be not a question of luck anymore, but a result of a good quality, safe and effective treatment. Therefore, I want to work on novel treatments of infertility. We have two ongoing projects at the moment, both of them in connection with PRP treatment of the ovaries. Our first project is a meta-analysis to collect and evaluate the so far existing data of this field. Nowadays, as the intention to having the first child is prolonged to a more and more mature maternal age, specialists who are working in the field of assisted reproduction have to face the growing challenge to treat patients with diminished ovarian reserve. Infertility affects around 1 out of 7 couples worldwide. Diminished ovarian reserve is one of the most common causes of death. IVF is the preferred treatment for these patients. As the graph shows, fertility of a woman rapidly decreases over the age of 40. At the age of 45, even with the help of assisted reproduction, the chance to having a child from an own oocyte is less than 1%. For these patients with the worst prognosis, oocyte donation is the only existing opportunity, but this is a very controversial option. It is not acceptable for everybody because of financial, ethical, and religious reasons. Enhancing the number and the quality of the own oocyte could be a good alternative for that. PRP is a very promising new method which was successfully tried out in several fields of medicine. In both human and animal studies, after the administration of PRP to the ovaries, the level of AMH and FSH improved. Some patients with very bad prognosis were even able to reach spontaneous pregnancy after this treatment. Despite this promising result, PRP treatment of the ovaries is still not widely accepted in the clinical field. Our aim is to conduct a meta-analysis and find out the effect of PRP treatment of the ovaries. We want to investigate the main fertility parameters and outcomes. We did a systematic search in these 5 databases with this search key. We got 41 eligible articles. Our results are very promising. 17% of the treated women were able to reach at least biochemical pregnancy, which means roughly every 1 out of 5 treated patients became pregnant. We have to emphasize that these patients were from the worst prognosis group. Most of them had several unsuccessful IVF treatment or infertility of decades in their medical history. For most of them, oocyte donation would be the only chance according to the existing protocols. At least 10% of the treated women were able to finish their pregnancy with a live birth. This number can be even higher because most of the papers were published before every ongoing pregnancy would be succeed with a live birth. Our most surprising result is a relatively high number of spontaneous pregnancy. 77 women, which means 6% of the treated women, were able to reach a pregnancy after the PRP treatment without any further hormonal treatment. Which is an outstanding result in this very poor prognosis patient group. If we see the other fertility parameters, the level of the number of AFC after the treatment was also significantly higher. If we see the IVF results, the number of retrieved oocytes and the fertilized embryos were also significantly higher after the treatment. The alteration of hormone levels were also favorable. In case of FSH, 2 and 3 months after the PRP treatment, the FSH improved significantly. In case of AMH, which is the most important factor of ovarian reserve, every measured months after the treatment showed us a significant improvement. We have to talk about the limitations of this study. First of all, the available literature in this field is very poor. Only observational studies were published so far. We also have to mention the big heterogeneity in the use and preparation of PRP, and also there was a big heterogeneity in the protocol of the IVF treatments after this. We have to mention that more than half of the patients we included was from 2 studies of the same authors. According to the data, PRP treatment of the ovaries is an efficient treatment for patients with diminished ovarian reserve. In my opinion, further RCTs needed with a greater patient number and with a carefully designed protocol to get more robust scientific evidence. We finished the manuscript. We submitted it to D1 journal. We got a rejection, so now we submitted it to the Journal of Ovarian Research, and we are waiting for their answer. As a second project, we want to launch an RCT in the same question. We want to find out what's the ideal time between the ovarian administration of PRP and the IVF treatment after that. In this study, we want to use the same PICO like in the meta-analysis. Here I listed the planned inclusion and exclusion criteria. Here I want to emphasize the role of the concept in the conception, the male factor. So that's why we want to exclude every couples from this study where there's several male factor infertility as well. In our study, the treated group, the intervention group, will get a PRP treatment and an IVF after that. The control group will get only the same IVF treatment. We want to examine the same outcomes like in the meta-analysis. PRP treatment is a very promising new method with a lot of questions to answer, but I think it can help a lot of couples to improve their quality of life. It's also important to highlight that it cannot simply support IVF treatment, but it can help those people with spontaneous conception who reject the IVF for some reason, for example, for religious reason. I want to finish my presentation with a quote. Everything is impossible until it's done. Thank you for your attention.
Do you use this method in your clinic?
No, no. In Hungary, nobody can use this.
Yes, we use it in pitch. Oh. We are doing it already.
I didn't know that so far.
So, because it is good and we have the first results, it is very promising. And it is also possible to use this PRP not just intra-ovarian but intra-uterine as well.
Yes, so I know that there's another line of this treatment to improve the endometrial thickness
yes.
for the poor implantation rate patients.
So perhaps we should talk after the...
I'm pretty sure, and I'm very, very sorry that my supervisor is not here because he is the
I thought that you are using it in your clinic, so that Miklós are using it, but then it is no.
No, he definitely not use it. I know, sadly. But
I also would like to have a question that the AMH levels, the increase in the AMH levels, were they correlated to the success rate of the spontaneous pregnancies? So, like, the higher the AMH got, the better the spontaneous pregnancy rate was, or the more successful the IVF was?
We cannot tell this because not every published paper published data for every outcome. So some paper published only about the number of atrial follicle count and the spontaneous pregnancy, whatever, and some others published data of the AMH. So there's some overlap, but it's so few patients that in basis of 100 patients, I don't want to tell anything. But as a common sense, it should be a connection between this.
When you were showing the forest plot for the spontaneous pregnancy after the PRP treatment, there was one study with outstanding rate of pregnancy. If I remember correctly, 8 women out of 26 got spontaneously pregnant after the treatment, which is very high compared to the other studies. Is there any possible reason for this? If you remember the article, what could be the reason behind this?
I think the first reason should be the very low patient number. So if we see only 30 patients, it's statistically not reliable. So maybe it's only it was the question of patient selection. So that's why we did a meta and put them together. And also the way of treatment, the number of administrations was also very, very various in these cases.